We wanted to take a few minutes to explain to you the changes that have been happening to the clinic, which might be affecting access to care at Sports Physio Plus. So as some of you know, we will now be 2 physiotherapists instead of 3 physio practicing this summer. And that got us thinking on how to optimize treatment plans and access to care. One of our current challenges is that when our patients are calling for a first appointment, the wait list is a little bit longer than what we had hoped for. So with the objective to reduce that wait time, we would like to integrate the role of the physiotherapy technologist into our care at the clinic right now. So some of you might know Isabelle Dumont and Mélodie Chénier. Isabelle Dumont is currently animating our osteoarthritis group classes at the clinic. And Mélodie Chénier is taking care of our phone consultations when patients are currently waiting for their first appointment. So both of them are practicing as physiotechnologists and they're an integral part of our team. So Amy's going to take the time to explain to you a little bit of the role of the physiotechnologist and how it's going to look like in the clinic moving on this summer.
Thanks for the synopsis. That's a good picture of how things have been around here and what we're looking to do with this change. So I'm happy to explain a little bit. So physiotechnologists as a profession first are members of the Order of Physiotherapists of Quebec, the same professional order that Kevin and I as physiotherapists are members of. They are independent and autonomous professionals who have the code of conduct to respect. They undergo professional inspections just as we do, and they have their own professional liability as well. And the main difference between physiotherapists and physiotherapy technologists is that the responsibility of evaluating, creating a physiotherapy diagnosis, and establishing a treatment plan, that responsibility still rests with the physiotherapist. But in collaboration, we can then use the help of the TPhys or the physiotechnologist to then provide the care and progress the treatment plan as well. So concretely, what is that going to look like? Yeah, so essentially the functioning internally here will be that the initial evaluation will be done by either Karen or I or any other physiotherapist who will be working with us in the future. And we would then create an individualized plan based on your needs, just as we do now. And then, depending on the case and the patient, we would then be able to transfer the care to the physiotherapy technologist, who can then take on the treatment plan that we've worked on to fit your needs and progress the plan along the way. If ever there's something that's not progressing as we typically see or expect, then the physiotechnologist can then refer back to us for reassessment if that should happen. So, as you all know, we have a really strong values around communication and collaborative working here. So that continued efficiency will lie within the main objectives to be able to provide the same quality care that you are used to receiving at Sport Physio Plus. If you have any questions or concerns or would like to understand in more detail the process of working with a physiotherapy technologist, we'd be happy to answer your questions. So we would invite you to write an email to info@sportphysioplus.ca, or if you prefer, you can leave a voicemail or message with April, our administrative assistant, and we'll be happy to give you a call back and answer any questions or concerns you might have. But all that said and done, explaining the logistics of everything, we'd like to introduce you to Marie-Ève Lacquière. We're very fortunate to have Marie-Ève as part of our team for this summer. Her expertise will no doubt be able to help patients with their treatment plan over the course of this summer, and for sure in the main goal of helping optimize the access to care. So without ado, I will introduce you to Marie-Ève Lacquière.
Hi, my name is Marie-Ève Lacquière. I'm from Fredericksburg and I am a physiotherapy technologist since 2 years now. I have a very big interest in healthcare and it has motivated me to continue my studies in occupational therapy at the Université de Sherbrooke, and I'm starting my second year next fall. So I'll be very looking forward to meet you this summer and help you with your treatment plan. See you soon.